Yeah. Have you got a title?
Yes, so it's just Medicines and Breastfeeding, but with a focus on medicines for mental health.
Fabulous. I forgot to say you're going to introduce yourself, but yes, you probably are.
I'll do it now, yeah. Is everyone able to see the slides?
Yes, I can see them.
Brilliant.
Yeah.
Okay, hi everyone. So my name is Seema Shah and I'm the Deputy Chief Pharmacist, and I've also got Fatima sitting in with me, who's one of our students who's just going to listen in today as well. Thank you for welcoming me to talk about medicines and breastfeeding. We will be talking about it in general, but also in terms of medicines for mental health as well. So we'll give a general overview on breastfeeding, which I'm sure throughout the week you've probably had already, so I'm going to keep it quite simple, and then talk about breastfeeding and mental health medicines, and then recommendations for discussions that clinicians and parents should have together. So I know that this is open to parents as well as healthcare professionals, so I've tried to target both, but please do stop me if you have any questions or if there's anything that's not so clear. And then information on breastfeeding and medicines changes continually. So I'm going to talk about where parents and where healthcare professionals can get more up-to-date information. So the World Health Organization recommends exclusive breastfeeding for 6 months, and the benefits of breastfeeding are well known. There are short-term and long-term benefits that have been seen. And when choosing whether to breastfeed or not, medication could be one of the factors that actually influences a mother's decision. So it's really important that we have those conversations early on. So, like I said, medicine's choices are really important, especially if the mother wants to breastfeed, and we should be helping them with choices to support safe breastfeeding. And where there is a risk of becoming unwell, there may be.
Is it echoing?
There's a bit of an echo.
Yeah.
Yeah, echo.
Has everybody got there? Is there anybody in your room who's joined?
No, no one's joined here.
Oh, it's gone now.
Oh, it's gone. Okay.
Okay.
That's good. Thank you. So, you know, there might be a risk of becoming unwell, and that might be really high. And where there's a high chance of relapse, it may not actually be possible to stop treatment. And for parents considering choices around breastfeeding, it's really important to have that discussion with a healthcare professional, because they can help you navigate the risk of becoming unwell and the risk of not taking medicines for a specific illness, and the risks of harm with continued medication during breastfeeding as well. And all of these need to be balanced out. As I mentioned before, information on medicines change all the time, and it's really important that the most up-to-date information is always sought. And like I said, at the end, there will be places where you can get this information. So for patients, parents, always let any healthcare professional know that you are breastfeeding. So anyone that you see, whether that's a doctor, a nurse, a pharmacist, a dentist, just in case they can pick up whether there are any issues. Where possible, healthcare professionals should try and prescribe medicines that only need once a day dosing. And that's because then the daily dose can be taken sort of straight after breastfeeding, but before the baby's longest sleep, to reduce the risk of harm to the baby. We try and avoid any medicines that are new to market. And that's because actually there's no information about them in terms of breastfeeding and no surveillance data as well. So where possible, new medicines should be avoided unless they're absolutely necessary. And remember to always consider any medicines are bought over the counter from the pharmacy. So always check with the community pharmacist. And also herbal medicines as well can have adverse effects. And it's really important that these are checked out, and you can check these with a healthcare professional to see if they're safe. But again, the evidence and the information will probably be quite limited. And again, a risk benefit assessment will need to be done. And some general information can be found on the site from the Breastfeeding Network, and you can have the slides afterwards and click into these links, so you can have a look at those. So some important factors in breastfeeding and mental health medicines. So first of all, depending on the medicine, we need to look at the safety of each medicine individually. As I mentioned, we need to have discussions early. So, even preconception, we need to be having these discussions about the plans for the pregnancy and then for continuing, breastfeeding as well, and seeing if the treatment options will be suitable for both the pregnancy and breastfeeding as well. Much of the time, they do say it's better to continue the mental health medicine that was used during pregnancy, to continue that throughout the breastfeeding phase as well. But there are exceptions to this. And as I mentioned, always double check with a healthcare professional. Benefits and risks, you'll hear me talk about this all the time, but because there is such limited information, we need to look at the whole picture. We need to look at it holistically. So you need to look at the risks to the mother and the benefits of having treatment and treating mental illness, and the risks to the baby of not treating the mental illness or treating it, and the risks with the medicine as well. And this is to allow informed and shared decision making. So it's important that all the information that's available is discussed. The mother's mental health does take priority, and where mental health medicine should not be used in breastfeeding, there needs to be a clear plan in place, especially if the medication cannot be withheld or switched. So when starting new medicines, so new mental health medicines whilst breastfeeding, what we need to look at is the nature of the illness. There are other options to medicine. So for example, psychology, and, considering other options as well. We need to look at which medicines have worked well in the past, because if they've worked, we're better off using that medicine than something else that may not work at all. And also how were they tolerated? Were there any side effects? We need to avoid those with high levels excreted into breast milk or high concentrations in the infant. And we need to also look at what we call the pharmacokinetics of medicine. So how long it will take the medicine to be eliminated from the system. And those with what we call a longer half-life actually accumulate in breast milk and in the infant's plasma as well. So again, different medications are very different. And so it's really important to take all those things into account. And, we do advise to speak to pharmacy. If you're not sure about the pharmacokinetics, we can always find out that information for you. And this all has to be shared decision making, looking at all the options and the choices. And again, we can provide some information in pharmacy for you, because we have access to some resources that not everyone has access to, and resources that we've signed up to as well. So again, use the lowest dose possible and the lowest effective dose, because it has to be treating the illness as well. As mentioned before, continue what was used during pregnancy. Where the baby has or the neonate has any clinical issues, or where there's impaired liver, kidney, heart function, or neurological impairment, we need to look at the risks of exposure from the different medicines. And a lot of the time it's breastfeeding and taking medicines may not be recommended in these individuals, but this should be taken in a case-by-case basis and a case-by-case scenario. And where possible, try and use a single medicine rather than multiple medicines. In psychiatry or in mental health, you'll find a lot of the medicines have very similar side effects, and that will add to the side effect profile, and that the side effects that the baby will get, but also that the mother will get. So where possible, try and use one medicine only. And then, as I mentioned, we need to have these discussions early, but we need to look at the physical and psychological negative impacts of the psychiatric illness to both the mother and child as well. So, looking at what happens if we don't treat, what happens if we do treat, and how that will impact both mother and child. And I'm sure there's a lot of other psychosocial aspects, which I won't go into today, that also need to be considered. We need to treat early. So it's really important that things are diagnosed early and treated as early as possible. So it's really important to discuss all the medicines with the parents and go through the side effect profiles, go double check all the interactions, whether any of the medicines, increase the levels of other medicines or increase the side effect burden, and how that can impact on the infant that's being breastfed as well. Like I said, there's limited information, so we need to always look for the most up to date because the information is changing daily. And we need to discuss the current information available and the knowledge on neurodevelopmental outcomes, because that, again, is not always readily available. We need to think about the side effects and how they affect the mother and the mother's ability to care for the baby as well. So again, a lot of mental health medicines are sedating, and especially if taking more than one mental health medicine, it could make the mother really drowsy and affect her ability to care for the baby. So again, thinking about that, and also thinking about how long it will take for the mother to get used to the sedating side effect, and whether it's feasible or not, or whether we need to consider other treatment options. Treatment rationale, it's always important to know and inform the parents, why it's important to treat and what the risks are if the illness remains untreated. And it's always good to, where possible, to give the different options and the safety profile of all those different options, so that the parents are informed about all their choices and can make the choice. Again, when you're talking about choice, again, discussing the risks, the benefits of starting, stopping, or continuing the treatment. And remember, when you're stopping treatment as well, and I think I've mentioned this a bit later, but there might be some withdrawal effects as well if you're stopping treatment whilst you've been breastfeeding, or, straight from pregnancy. So again, all of that needs to be considered. We talked about the pharmacokinetics, so things like depot antipsychotics or long-acting injections, anything with a long half-life will accumulate, and it's not recommended for people that are breastfeeding. So we talked a little bit about the clinical status, but considering the age of the baby as well, and the dosing times based on the feeding times, and where possible, like I said, it should be once a day dosing. Everyone should be given written and verbal information, and all these conversations should be very clearly documented in the patient's electronic care record. Signpost to further information and advice, and again, I will signpost a bit later. And discuss the other support that the team are going to provide, and how the team should be contacted should they have any concerns as well. And then you do need to look at if the infant was preterm, low birth weight, or has any other illnesses. And generally, they do say anyone that's premature or unwell should not be exposed to medicines via breast milk. But like I said, this needs to be looked at individually, perhaps with a discussion with the pediatrician, and looking at all the other medicines the mother is on and the time of dosing, etc. as well. Okay, what else we need to tell the parents? What monitoring is going to be required of the infant and the likely side effects that they may experience, and what to do if the infant shows signs of toxicity, and what those toxicity signs are. How will they be followed up? Who's going to be monitoring? Who's going to be doing the long-term follow-up? And it's not appropriate to withhold treatment for breastfeeding to continue, especially if the mother is at a high risk of relapse. So again, there will be times where possible we do need to support and promote breastfeeding, but there will be times where it is not possible because the treatment is really important but actually contraindicated in breastfeeding. But again, if these conversations are had early enough, it may be that even preconception medicines can be changed to something that's more appropriate. And advice, like I said, should be given about stopping mental health medicines, because this will also cause withdrawal side effects in the infant, depending on what medicine it is. So again, it's really important that medicines are not stopped abruptly, and parents seek advice from healthcare professionals about how to do it in the most appropriate way. And then on top of that, we also need to then monitor for signs of relapse and any other signs as well. So it's really helpful if this is done in conjunction with a healthcare professional. So I'm just going to talk about some general advice for different medicines groups. And this is really, really general. And the reason I've kept it general, like I said, is the evidence is changing constantly. And so, you know, even tomorrow, this may be out of date. So it's important that you do look at the most up-to-date information when actually giving the advice to your patients or to parents. So antidepressants, it's not advisable if the baby was premature, ill, or low birth weight to be exposed to psychotropic medicines through breast milk. But again, this can be looked at on a case-by-case basis. Most evidence is only from case reports or case series, so none of these have actually been trialed in a controlled way, or where they have, you know, it's not sufficient information or evidence. It's usually advisable to continue what the mother used during pregnancy, so unless it's contraindicated or high risk in breastfeeding, because you know that's worked. And it's always better to use something that's worked rather than trying something new that may not actually work. And then, you know, the risk benefit ratio shifts a little bit. If you are considering initiating antidepressants postpartum, then sertraline at the moment is considered first choice. But again, choice should be guided as well by what has worked well in the past. And where possible, they say to avoid citalopram, escitalopram, and monoamine oxidase inhibitors. And the other antidepressants have limited evidence. So again, you need to consider risks, benefits, and like I said, what's worked for the mother in the past, what adverse effects have they had, and how well has that been tolerated. And then looking at antipsychotics. So again, the data is quite limited and conflicting. Again, it's not advisable for babies that are premature or have low birth weight or have any clinical conditions. Of the second generation antipsychotics, a lot of evidence is available for olanzapine, but quetiapine has a shorter half-life, and so that's recommended as the preferred option at present. But some of the side effects that you do need to monitor for would be things like sedation, muscle rigidity or tremors, and you know, looking at the developmental milestones as well. Breastfeeding whilst on clozapine is contraindicated. So again, these are conversations that need to be had earlier if the mother is on clozapine. And you need to avoid, like I said, depot or long-acting antipsychotic injections. And then moving on to benzodiazepines and hypnotics. So these are sometimes used for anxiety or to help with sleep. And benzodiazepines should be avoided. They're not really ideal for breastfeeding mothers due to their sort of long half-life, and you can develop dependence, and even the breastfed baby can develop dependence as well. Some of the shorter acting benzodiazepines may be used if it's absolutely deemed necessary. Again, this should be a very low dose and short term, and that's because it is shorter acting. But it, you know, again, like I said, it should only be really for short term treatment of severe anxiety and agitation. And again, risks, benefits need to be considered there. Again, for sleep, where possible, we should be avoiding benzodiazepines and hypnotics. But if treatment is strictly indicated, what they call the Z hypnotics, so zaleplon, zopiclone, for example, could be used, but it has to be short-term or intermittent use. And, you know, and we need to ensure that the baby was healthy and full-term as well, because the adverse effects could still affect the baby. And they do recommend that to discourage bed sharing when the mother has taken a sedative or hypnotic medication. So bearing that in mind, I've said it here for benzodiazepines, but there might be other mental health medicines that also make them quite sedated. So just keeping that in mind. And then monitoring infants for side effects, again, such as sedation, lethargy, mild jaundice, weight loss, and any central nervous system depression. And there have been some cases of breathing difficulties noted as well. And then moving on to mood stabilizers. So NICE advises that if we need to use something to prevent bipolar affective disorder, then an antipsychotic would be first choice, except for clozapine. So like I mentioned earlier, quetiapine or olanzapine could be options. Where women who are already taking an antipsychotic, they should be encouraged to breastfeed unless it is clozapine. You need to seek further advice on women taking carbamazepine, valproate lithium, or clozapine, as these are not recommended and are contraindicated in breastfeeding, as there are a number of risks that have been identified with them. And if the woman is on combination therapy, or if there are other risk factors, again, you need to seek specialist advice, especially due to the adverse effects that could happen in the infant. And some of the side effects with the mood stabilizers would include sedation, feeding difficulties, lack of adequate weight gain, and sort of developmental milestones also would need to be monitored. And also looking at unwanted effects associated with antiepileptics if they were on antiepileptics. So there you have it. That was my very quick whistle-stop tour. But what I do want to go through is some of the information that you can get. So with parents, they can use the Medicines Helpline. And so this is run by the South West London and St George's Mental Health Trust pharmacy team. And you can speak directly to one of our specialist pharmacists who will go through any queries with you about medicines in pregnancy and breastfeeding. And we are linked into the National UK Medicines Information Service. So we do have access to a number of resources that not everyone has access to. So we can look at the most up-to-date information and sort of provide the risks and benefits. And this is also available to healthcare professionals as well. There's the choice and medication website as well, which at the end of this, I'll show you how to navigate that website. And there's a lot of useful information on that site, not just for breastfeeding and pregnancy, but also generally for mental health. There's the NHS website, and then the Breastfeeding Network drug fact sheets as well. And as I mentioned, so the two I've mentioned already, and then there's the Specialist Pharmacy Services and UK Drugs in Lactation Service, and they have medicine-specific advice for medicines during breastfeeding. And if you click on the link here and you get the slides, there's a guide on how you can access this information. There's also the NICE and the BAC guidance, and there's LACT-Med, which is in the US National Library of Medicine, and it's a reputable resource that we use quite regularly, but just being aware that it doesn't have all the medicines licensed in the UK because it's a US site. And then, as ever, what we normally use, we have the British National Formulary and the Children's British National Formulary, and each monograph will talk about breastfeeding. And you also have the manufacturer's summary of product characteristics, but be aware that in the summary of product characteristics, they will generally say that breastfeeding is not advised because it's not been trialed, usually in most medicines, and a lot of them are not licensed for being used in breastfeeding. But it's useful to get some information, especially on side effects and things like that as well. So before we move on to questions and before I show you the choice of medication website, just remember there's not always a lot of evidence or information available. So it is really important to do that risk and benefit assessment when you are considering medicines in breastfeeding and looking at the holistic picture and other treatment options that may not be medicines as well. And before I move on to questions, I just see if I can get that website up just to show you things you can access on it. So this is the choice and medication website. And on here, there's quite a lot of useful information. There's handy fact sheets, and they're available on different things. So if you're on antidepressants for the first time, on clozapine, and lamotrigine, lithium, and when you're stopping and coming off medication as well. And there's also information on side effects. Give me 1 second. And there's also translated leaflets here as well. And if you look at the handy charts, you can also look at it in terms of the illness. So for example, if I'm looking at something for bipolar mood disorder, it gives me a very good table on how I can actually look at what the side effects are and compare them. So if I wanted something that didn't cause a lot of weight gain, for example, I can see that, you know, for example, aripiprazole has lower weight gain than olanzapine, and I can compare that medication and look at some of the main side effects as well. And if you go into the individual monographs, it gives you a little bit of information on breastfeeding. So if we think about, let's go into aripiprazole, and it will also tell you about pregnancy as well. So and preconception, and there's some information there on breastfeeding, which again is quite general, and we still recommend people talk to their healthcare professional, but it's a useful website to get just some general information for people to use. And that's it from me. So that's just a short whistle-stop tour and sort of the general comments. I didn't go into any great detail because, like I said, things change quite a lot, and you can always contact our helpline to you know, get the more specific information specific to the case that you're dealing with, or for patients and parents, you can contact us as well, and we can give you information specific to your needs as well. But yeah, thank you very much. And do you have any questions?
Janet's just left a note saying she actually has to make a call, but does anyone have questions for Seema? I thought it was a really, really good presentation, actually, and it's just very succinct and tells me what I need to know. But the website, actually, at the end, I hadn't realised it had that much information, so it's really good. And we can share that with our clients?
Yes, yeah, that's available for everyone. But I think what I find is not everyone knows the full use of it. Like you said, even healthcare professionals and patients, but there's a lot on that website that can help you make decisions. So even when you're deciding on a medication for someone who's breastfeeding, they can still, you know, they're still going to need to know the side effects for themselves. And so it's those charts are quite handy. But generally, yeah, when they're looking at choice, it doesn't have all the side effects in these leaflets, but it will have the main one. So you should still look at the manufacturer's leaflet. But the website also has a lot of other information on how to deal with side effects as well. So quite useful.
Yeah, and it's interesting you say you should try and stick to one medication, but it's quite difficult to, I think, at times.
Yes, I can imagine. And that's where the risk conversation comes in, but also the monitoring and how the baby's going to be monitored.
I think it's really, I think it was really good, because for me, being a social worker, when I go to see my ladies, I'm not medically trained. So that information is really, really great, because it's good for me to know as well. Because a lot, what we find with us is a lot of our referrals come through. And when I on duty, one of the things they would say to you, I don't want to go on medication, you know, because I'm breastfeeding. You know, so even if I could see, you know, we have certain leaflets with the basic ones like sertraline and stuff, but I think this is so informative in terms of, you know, give them the choice and the side effects. So that was really, really grand, really good stuff.
That's good.
Thank you.
Thank you, Seema. I was just going to ask him. This is Roisin, who's one of the nurses. I was reading about promethazine once, and I sort of read that if it's taken when the mom is just trying to start off breastfeeding, like a new mom, that promethazine can inhibit the production of breast milk. I don't know, or reduce it anyway. You know, in terms, especially if it was maybe they're just really starting off.
Okay, I'll have to be honest, I don't know the answer to that on the top of my head, but I can email you, Roisin, with the details.
All right, thank you.
And you do know that we also have trust guidance as well, that actually I didn't put on here, but I have reference. So we do have trust guidance, which I think includes promethazine, so I'll include that for you as well.
Yeah, thank you, because that's sort of widely prescribed, isn't it, promethazine? And I know,
Yeah.
you know, women can buy it also over the counter. So it is one of those things that, you know, yeah, we see a lot of.
Quite a lot.
Yeah. And so just to clarify, that the choice and medication website that's under South West London, patients can actually access that as well, can they?
Yeah, if they use the link that I put on there, they can go directly into it.
Okay, that's wonderful. Thank you. It's
Yeah,
all
that's
wonderful.
really
Thank
good.
you.
Yeah. And do you still have the little cards?
Yeah, we usually put them in our discharge medicines, but if you want some, I can get some over to you as well, because that also has the number of our helpline on there.
Yeah, it'd be good to just have some more. We may have just a small pile left. So yeah, that would be great. Thank you. Any more questions for Seema?
No, it's been wonderful, Seema. Thank you.
It has, and I think a lot of people will probably go back and look at the video, because I know they'll be really interested in this. We were just saying earlier before people arrived, it's the annual leave periods and people don't work Fridays, so
that's fine.
We thought it would probably be a bit quieter today, but it's on the YouTube channel, so people can look back at it as well. But yeah, no, that's really great. Thank you.
Thank you. And I've left my email address there. So Roisin, for example, if I don't get back to you, but I'm going to try and get back to you now, just drop me an email and I will get that information to you.
Thank you. That's kind.
Great. Okay, so yeah, let's finish then, and wish everybody a good afternoon and weekend. And thank you, Seema, for that.
Thank you, Seema. That was really good.
Thank you for having me.
Thank you.